This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
I have a follow-up comment from Katie and then another question from Saleh. So I'll read out Katie's message. About to do my 5th FET. I've had 1 chemical and 3 total failures. 2 FETs included immune protocols, steroids, Clexane. What kind of further testing should I be asking for, or do you think it's a numbers game? I don't want to just keep wasting precious embryos. I'm going to post your contact details in the chat as well.
I'm not a believer in immune therapy. I'm not convinced it makes any difference. There are no randomized controlled trials that suggest that it makes any difference whatsoever. I'd be careful about the doctor who is putting your embryos back. Are they doing it under ultrasound guidance? Then beyond that, obviously age, as I've just been talking about, age is important. If you published data, which paper that I was involved in out of the Australian data, suggests that if you are, let's say, 38 years old or below, and you've had, this is on your 5th transfer, you should have a better than 70% chance of a pregnancy. But that still doesn't mean everybody's going to get pregnant by any means, but it's 70%. I certainly would be talking to you if you produce those sorts of numbers of embryos about genetically testing them for, again, the same reasons as I've talked about before, that a lot of the failures are because the embryo going back is actually an aneuploid embryo. So I would, if I was looking after you, or you've got an embryo obviously in the store and you're ready for your transfer, if you want to keep using the steroids and the Clexane, it probably does no harm, but I'm not sure it does any good. Being sure that your progesterone levels are good before the transfer. I've started in the last 12 months actually measuring progesterone the day before a transfer in these difficult cases, and finding suboptimal levels. And then we either cancel a cycle or we bolster it with even more progesterone leading up to the transfer. But that fine-tuning, I think, is something that, going to a specialist who understands things is very important. I keep saying this, but there are many people doing IVF in Australia, many specialists who are basically gynecologists, obstetricians who do a bit of IVF on the side. I'd make sure you were seeing someone that knew what they were doing.
So, Prof, I think you mentioned in the past as well to check that they have a CREI qualification. Is that right?
Yeah, well, that's the top of the pile in terms of qualification that says you've done 3 years of extra training in the area. Most generalists who do IVF may have done 3 months or maybe none, and are just learning on the job, basically. Yeah, so CREI is a marker on the end of there. It's called FRANSCOG, which is the college qualification, which all specialists have. And then on top of that, there's something called CREI certification in reproductive endocrinology and infertility. I would certainly be searching out someone with that, because in almost every state in Australia now, there are a number of CREI doctors.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.